Hi there, it's Matt with the Caring for My COPD program. Today I'm coming to you with a video on inhaler technique for, they're called a pMDI device, or one that kind of looks like a rescue inhaler with the canister on the top here that you push down and releases the medication. So the medications that come in this device are typically known as Advair or Zenhale, Flovent if you have one. I think those are most of the common ones. So specifically about Advair, Flovent, and Zenhale, those medications have a steroid in it. And having a steroid in those medications, the one thing you want to be sure to after you take the medication is to rinse your mouth out afterwards and spit that water out. That's to help reduce any chance of thrush building up inside your mouth. So rinsing your mouth out after taking these medications is really important. So I'm going to go through how to do the proper technique with this device and also how to clean it. So starting off with the technique, you can take this medication with just the device, or if you have an aero chamber, you can also use an aero chamber with this device too. Fits in the back like that. For this video, I'll just go through how to use it without the aero chamber. If you want to know how to use the aero chamber, I've got another video on your rescue inhaler that I talk about it in there. So we can watch that. Alrighty. So starting with the technique for this one, we're gonna shake it about 4 or 5 times. Take the cap off. Now, just before you go to take it, just make sure to have a look inside that there's no lint or anything inside there, especially if you're not using a cap, just to make sure you're not breathing that in. So once you're ready to take it, you're going to breathe all the way out to the side. Then place your mouth in. Then you're going to start your breath just a half second before you push down and release the medication. That's so that there's some flow of air for the medication to jump into. Once you release the medication, continue your breath in for a slow, deep breath, and it should take about 3, 4, 5 seconds to get to the top. Once you get to the top, you can remove the mouthpiece and hold your breath for 5 to 10 seconds or as long as you can. Then breathe out, and if you have to take a second dose, wait about 30 seconds before you take that second dose. So I'll do a full demonstration here for you. So I'll shake it. Well, I'll put the cap back on first. Breathe out to the side. So one thing I forgot to mention, when you go to push down on the medication and breathe in, you only want to push on it once. So you want to just go one time. You don't want to do any double pumps like that. So just one go. If you're prescribed to take 2 doses, then just repeat that same maneuver a second time with about a 30-second break in between. So that's the technique with this device. When you're cleaning this device, you can kind of dismantle it. So take the cap off, take the canister out, and you can just wipe down the canister with a damp towel. With this piece here, these pieces, you can use warm soapy water to clean it. Dry it as best as you can, and then let it air dry just after you dry it to make sure that there's no moisture or condensation inside. Mine is white, but if you have Zenhale, the container is blue. If you have Advair, the container is purple. You might see a little bit of white buildup just on the base of the mouthpiece here. So make sure that you scrub that area and get it clean too. You can clean it every couple of weeks or however often as you see fit, depending on maybe how much debris is building up inside the mouthpiece. So that's how to clean this device. We reviewed the technique. So thank you so much for watching today. We'll see you next time.